Okay, so we're going to start. We only have an hour, so I hope that we will get through everything. Or do we have a little bit more than an hour? No, we have more than an hour. So what we're going to do today is actually two birds with one stone. So you will see, for CPI 206, we are going to look at infection control, CPI clinical technology instrumentation. That's the third module that we're doing today. But also CPP, the practical subject, we are also going to look at infection control. So we're going to do the two together. So the theoretical part, we will go back to module 3 to go and finish what we've learned about temperature next week when we see each other again. But today I'm going to continue with module 3, infection control, because I need to show you the theory before we can do the practicals next week. So I see a lot of you did bring your lab coats. It wasn't necessary for today, but for next week when we're in the sim lab, you are definitely going to use them. So, but thank you, it's fine, thank you for bringing them today. Okay, so when we look at infection control, I'll let this thing work now on this laptop. We generally refer to, or you will hear the term isolation. Now, with the COVID pandemic that's going on, isolation is not something new. It's something that we hear and see a lot about in the news. We hear about people isolating themselves when they have been exposed or when they are COVID positive. They go into isolation and they try to restrict their contact with anyone of the public in order to prevent the spread of the disease. Now, isolation in the hospital terms is a very similar concept. So isolation is not something new to the healthcare profession. For instance, people that get an organ transplant will usually also be in isolation for the time being after, or for the time period after the transplant due to the infection risk, or people that are immune compromised, like some of the cancer patients, they are also in isolation, so they restrict the entry of people to visit those patients. You sometimes get what we call an isolation ward, where the entire ward is being isolated and everybody inside that ward are then protected, or they are held in that specific ward in order to protect the spread of the disease. At Pedenome Hospital, there used to be a TB isolation ward where the TB patients were then they were admitted into this ward, where they then were isolated in order to spread or prevent the spreading of the disease. So with isolation, you will see there's a lot of things that goes hand in hand with that. For instance, hand washing, very important. Wearing of protective clothes, such as a mask, which we are very familiar with, gloves and gowns, which you now are not so familiar with, but I'm sure you know the mask, eye protection. Then how do we take or prevent ourselves from being exposed to sharp objects that might have been used in that specific ward or room or patient, and how do we dispose of the items that we use? So you can imagine that if, for instance, gloves are used in an isolation ward, and we just throw the gloves where somebody else can pick them up or are exposed to them, the whole principle of isolation is null and void. So we need to make sure that when we do dispose of any medical waste, particularly waste that might have some sort of infection on them or microorganism, that it does not infect the rest of the environment. So you will see, I don't know if you've noticed, that sometimes there's a truck that stops here in front and they come to collect the medical waste from the biomedical technology. So there's specific companies that actually work specifically with disposing of medical waste and specifically then products that have been used in isolation ward. This thing can make it difficult. Okay, so that is how an isolation ward would look like. You can see here, this is now a very, this is just a simulation because you can see the patient is a mannequin. But this is how they sometimes train some of the healthcare professionals if they are going into a specific area where there is a high risk. And you can see here, this patient has been isolated by means of this plastic tent. The healthcare worker is wearing what we call a hazmat suit to protect himself. You can see that he has his own breathing apparatus if this organism is possibly airborne, so that the healthcare worker cannot inhale and get infected. And then it's in a different or another room in order for this person then to exit here, where he or her can dispose of that clothes safely and then go out to the next patient or outside of this unit. Okay, so here this is in a hospital. Here you can see this person has a different type of gear on. You know, the face shield, so this person has a face shield on with the N95 mask. Now the N95 mask is a specific type of mask that filters out a specific particle size so that microorganisms cannot be inhaled. The masks that we wear, or that we are supposed to wear, does not really protect us from inhaling specific particles because they are sometimes open, but they do actually protect in the sense of exhaling. So that's why we all wear it to protect each other. So if you are really worried about inhaling specific organisms, you can then wear N95 mask. I like to call it the Donald Duck mask because when you look at it, it looks like a duck bill. I don't know if you've seen it before. And they were specifically made when you work with TB patients, but they work very well in the COVID wards as well. What's interesting on this picture, you will see here, here's a separate, the sharps disposable. Now the sharps disposable is this, very similar to this, where all the needles and sharp objects like the scalpels and that type of thing are being discarded in, and you can see that person is coming in with a separate disposable waste bin for the sharps for that particular patient. Here you can see the floor plan of an isolation room. This is just for interest sake, so you will see that sometimes the patient will have a room and will have a separate bathroom. You will have a room that is or door protected from the hallway, so there's two doors. So the patient's door never exits directly into the hallway, so that it's protected. And those two doors are never to be opened simultaneously. Okay, so there's a washing up area where the person that's going into the room can dress up and dress down again. And as you know, with COVID, if they ask you to self-isolate at home, preferably you should have your own bathroom. You should not share the bathroom with the rest of your family members. So this is a little bit of a game that we play, where you can guess which organism or which virus am I talking about. I am a blood-borne virus. Who do you think that is? Most common infection are through small quantities of blood.
HIV.
HIV, okay, let's see if you're right. Now this thing again. Sorry about this. In 2016, I alone killed almost 4,000 people. I have infected 71 people globally. I am a liver disease. Okay. You still think it's HIV? I may cause cirrhosis of liver and cancer. Okay. I am hepatitis C. Okay, so who of you have been immunized against hepatitis C? Okay, so it's important that before you go into the hospital, you must be immunized for hepatitis because it is a very serious disease. Okay, next one. In 2018, I infected 228 million people. 405,000 of the infected people died that I infected. I cost the healthcare $2.7 billion a year. I am caused by a parasite. You know what it is. I am malaria. Okay, so you can see that there is quite a lot of health diseases out there that are commonly known to us that sometimes we are so focused on those movie type of infections that we forget about the things that's right at our doorstep, because you can go as close as the Kruger National Park and you might get bitten by a mosquito and get infected by malaria. So malaria is not, especially if it becomes cerebral malaria, is quite dangerous. Okay, I know that there is a lot of projects going on of trying to rid, especially Africa, of malaria. A lot of fundraising going on. And I've personally worked with people that has been infected and survived, as well as passed away of malaria. One of the last resorts that you can do for a patient with, and I've only seen it once, is where they do a what we call almost a red blood cell transfusion with a dialysis machine, trying to exchange the patient's blood. So it's almost like a massive blood transfusion. It's very dangerous. I've only seen one. Unfortunately, the person survived. But yes, malaria can be very, very dangerous. Okay. Leprosy. We know leprosy from the biblical times. I'm not going to read through all of that. You can go and read through that for history's sake, just for interest sake. And you will see that this slide presentation is different from the one that's on YouTube. So the one that is on YouTube is the facts that I want to know. So I will not ask you about leprosy or malaria or the cost of malaria. This is just for interest sake. Okay, so there is a patient with leprosy. We know in the biblical times this was quite a difficult disease. People were shunned out of the villages, and they had to go and live in these leprosy communities, and it was quite a difficult sickness to treat. And as recent, I think, as I want to say 1960, 1970 roundabouts, which is what, about 50 years ago. So South Africa still even had some leprosy wards where people with leprosy were treated. So it's not such an old disease, but for nowadays it's fairly uncommon. Okay, now influenza, we all know. A few years ago, we've all heard about bird flu and swine flu, and there's a whole bunch of things: H1N1, H5N1, H7N8. They can cause quite a scare. I've attended a lecture from one of the, he's a South African doctor, but he works in China, and when the bird flu hit China a few years ago, it was very similar to what we are experiencing now with COVID, especially in that area. And they had the healthcare workers, the hostels were emptied, the students were sent home in the academic hospitals. They asked that the healthcare workers come and stay in the hospital so that they are close to the hospital, and that they can't go home because of the risk of infecting the people at home. And quite interestingly, that not one of the healthcare workers that worked specifically in the Chinese hospital refused to work. They actually said, or he said, that even people that were on pension came in and started helping within the hospitals to treat the people with the avian flu or the bird flu. They had little desks. The only place where you were allowed to take off your mask is when you were eating. And these little desks had like perspex, with like perspex cubicles. And yes, so that's the only place where they were allowed to take off their mask. And he said the worst thing for him was the day that he entered the ICU and one of his colleagues were lying on the bed being ventilated. It was a young woman, and she passed away. He said, you'll never forget that. He said, that is the worst thing when one of your colleagues gets sick and you have to treat them. So bird flu is also not something that we can just ignore. Okay, so there's you can see, that's the H7N1 of N9 version. You can see there everybody's have hazmat suits on, and they are busy treating the patient. And this is something that we forgot about. If you talk about bird flu nowadays, a lot of people can't even remember, but this was quite a serious disease. Okay, corona. We all know about corona, so I'm not going to spend too much time on that. I think we've all heard a lot of it. You can see this is still in the beginning stages, 4 cases, 5 cases. Now we're talking about millions. So corona spread like wildfire throughout the world, and we all know what the end result of that was. Here you can see them busy testing the people for the coronavirus. Okay, also in hazmat suits. I think this picture actually was a person that was trying to escape Wuhan in those when it started out, and they caught him, and he was led away. Tuberculosis, also a very serious disease still in South Africa. So we're still battling tuberculosis. You can see a total of 1.5 million people died of tuberculosis in 2018. That is a lot of people. If you compare that to coronavirus, this is actually quite serious. Okay? And this includes the 250,000 people that, with HIV, because we know that TB and HIV sometimes go hand in hand. HIV, the one that you mentioned, also a really serious problem, but nowadays HIV is quite manageable. In the 80s, it wasn't so manageable, but nowadays it's a disease that, as diabetes, if you take your medication, you can still have a very long and prosperous life. Okay, so just claimed HIV still serious, 32 million lives so far. So that is also quite a lot of people that have died of HIV. Congo fever, also a very scary character to deal with. And this is something that we see in our region, in South Africa. They've treated some in Eddie Clinic, they've treated some in Rose Park. The problem with Congo fever is sometimes, you know, it's a bit too late that it's Congo fever. The patient will come in, and that's the little gogga that causes it. That's a tick, and it looks like tick-bite fever. And then by the time that the Congo fever result comes out, a lot of people already has been exposed to it. So if you do expect, or if there's any suspicion that it's Congo fever, rather be safe than sorry. Make sure that you have your protective clothing on, because this is a hemorrhagic disease, and it's quite fatal. And don't let that little gogga bite you. Okay, Marburg virus, also a hemorrhagic disease, and you can see all of them, these serious guys, come from the same animal, and you can see here what some of the signs and symptoms look like. This is something that you don't want to get infected with. Who can guess which this one is? It's a family member of the Marburg virus. It's Ebola. One of my favorite viruses, if I can choose a favorite. This is a really scary one. And if this thing should start spreading through the world, it will be the end of the world. That's just the problem with Ebola, or not the problem, the benefit of Ebola is that it kills the patient so fast that it doesn't have time to spread. So in Africa, especially in Western Africa countries, they would come to a village and the whole village would have been dead before the virus could have spread. With the last Ebola outbreak that we had, it mutated, and the people were they were sicker, they weren't as sick, so they didn't die as quickly as with the previous variants, and it spread faster. So it's as if the virus mutated itself to become less effective in order to be more effective. So the virus actually spread quite fast, and that was a serious problem. So this is something that closes borders within days. It's a little bit different than Corona. Corona is a worldwide problem, and it's a serious problem, but Ebola is the one that they make movies about. Okay, so it was discovered in 1976 near the river Ebola in the DRC. There was quite a lot of outbreaks from Africa, Sudan, Uganda, Gabon, Liberia, Sierra Leone and Nigeria. In 2014 we had another outbreak in West Africa. So there's and the case fatality rate is about 51%. In 1996, which is not too long ago, we had Ebola in Johannesburg, and the nurse passed away, unfortunately. And there were some few infections in Italy, USA, but because of the fact that it's overseas, and by the time that the person gets on the plane, they are usually already dead. That's why the infection doesn't spread so fast as with Corona. So here you can see just some of the places where there was outbreaks, and again it comes from eating contaminated meat, where the virus is then transmitted to the humans. Here you can see some of the variants. The Sudan one had a fatality rate of 50%. So if you were living in a village and you were looking at your friend, either your friend or yourself was going to die of Ebola. Whereas the one that was in Bundibagayo only had a 30% fatality rate, but because of the fact that it can spread so fast, more people can be infected. Okay, that's just the transmission. As I said, again, it comes from animals, contact with the blood, people that, and one of the other things with Ebola as well as there's quite a lot of the cultures that have a ritual of bathing the body, washing the body. and that is where a lot of the contamination also takes place. Okay, so here is some of the signs and symptoms of Ebola. You can see there on this child's back. Again, very similar to the Marburg virus. You see that capillary leak because it's a hemorrhagic disease. Here's another few patients, a lot of bleeding out of the mouth, nose, and sometimes even out of the ears. Prognosis, some have a fatality rate of up to 90%, which is quite high. Most of the people die of shock because of the fact that they're losing so much blood. And you can see that the Zaire variant is the one that has the fatality rate of 90%, which is very high. Okay, Ebola has no cure. I know that some, I think Pfizer tried to make a vaccine. They are still busy with it. I don't know how far they are with that. But you can only give supportive treatment. Oxygen, maybe some of the antibiotics to prevent a secondary bacterial infection, some analgesic for the fever and pain, fluids, and that's it. And then you just hope for the best. Like I said, there is some experimental drugs that's going on that they are trying to do, but at the moment I think everybody is focusing on coronavirus. I think Ebola has taken a little bit of a backseat. There's some other examples of the hemorrhagic signs that you can see. There's a picture of where they are taking some of the corpses out of the village. You can see they are all dressed in hazmat suits as well. This was actually when the recent outbreak. There was a nurse and a doctor that were working in Africa from America. The nurse unfortunately passed away. The doctor was transferred to America, back to America. And this is how they transported him within that specific, it's almost like a tent type thing. Everybody wearing hazmat suits. A lot of the Americans were quite scared because imagine if the outbreak were there, they were separated by water, and now all of a sudden it's on their own home turf, and the doctor survived. Here you can see, like I said yesterday, a lot of the transmission happens when people dress and undress, because remember the hazmat suits are exposed to the virus. So before they undress, they have to wash themselves or each other with a specific antiviral soap in order to make sure that there's no virus on the suit. And there you can see also this person standing there, and they're spraying him with the antiviral solution. Okay, there's just again where they are transporting that doctor. And this was just some of the information advertisements going on in order to try and educate the people how to stop the spread of the Ebola virus. Here's somebody that they are treating. You can see that the conditions are not at all very nice. These countries are very, very poor. The people are really suffering, and it's sometimes very difficult to stop an outbreak in countries like that. Here, a child is being led away that's been exposed, so you can imagine if that was your child. And you don't know what is going on. A lot of these children are usually orphaned because of the fathers and mothers and the grandfathers and mothers passing away. And then the family members are not allowed to bury the family members. This is being done by teams like this in order to ensure that no infection takes place. Okay, so that's just a little bit on the infection control, just a little bit of background history on that. So you can see it is quite serious. Some of these diseases you will never be exposed to. Some of them you will be exposed to, especially TB, HIV, Just want to make sure if I'm on the right PowerPoint now. Any questions so far? Okay, so this one is the one that's similar, that will be on your Itutu. So this previous presentation was not to scare you at all. This was just to show you that there is definitely organisms out there that you should protect yourself against. Some of them are serious, some of them are less serious, but it's your responsibility to protect yourself, and it's also your responsibility as a healthcare worker to protect the patients. So that is very important. You will learn of diseases such or organisms such as MRSA, which is quite serious. You will learn about nosocomial infections, and these are things that we as healthcare professionals are not not immune to, but that we are protected against that, but we can cause the spread of that, and we must make sure that in the end we don't cause the death of a patient that might have lived due to something like that. Okay, so nosocomial infections we're going to look at, infection control in general, some of the pathogens, routes of transmission, essential standard infection control, hand washing and contagious diseases we've now looked at, and isolation. So what is an infection? An infection is the multiplication of organisms such as bacteria, viruses and parasites that are normally not present within the body. An infection may cause sometimes no symptoms and be subclinical. We've all heard about the asymptomatic coronavirus carriers, but it can also cause symptoms and be clinically visible. So a patient will have signs and symptoms that you can actually see. An infection may remain localized, which means that it is only infecting a certain part of the body. For instance, like cystitis, which is an infection of the bladder. Or appendicitis, which is the infection of the appendix. So the rest of the body is still okay, but that specific organ is infected, but it can spread if it's not treated. It can then also become systemic, especially if it starts transmitting through the blood and the lymphatic system, because we know the blood and the lymphatic system has access to the entire body, and then it can become quite a serious problem. Okay, we also know that we have microorganisms that lives naturally on the body that is not considered infectious. Okay, normal flora that we find on our body. Exactly the same as the normal flora that we find in our gut. But sometimes these bacteria can cause infections, opportunistic infections, if we have some sort of immune compromised disease. Okay, this thing is going to irritate me now. Okay, so what is a nosocomial infection? A nosocomial infection is known as a hospital-acquired infection. So it's something when a patient is actually healthy, going into the hospital, but then are infected with some sort of microorganism while he or her is in the hospital. Then it's a nosocomial infection. And this happens quite often. It's not something that's it's not common. So nosocomial infections, the most common types, bloodstream infections, ventilated associated pneumonia, this is quite a common one, urinary tract infection, as well as surgical site infection. So a patient might go in for some sort of surgery and then gets infected due to maybe some non-sterile technique or something that happened, and that infection site, that surgical site then gets infected. Urinary tract infection, especially if the patient gets, if a catheter gets inserted, the patient might contract a urinary tract infection. Ventilated associated pneumonia, we all know the upper respiratory tract, part of giving us the ability to speak and to eat. It also protects our lungs from organisms, because we have mucosa, a nasal hair, and the cilia in the lungs that protect the organisms or prevent the organisms from going into the lungs. Now, when we intubate the patient, meaning that we put an ET tube into the patient's mouth, right into the trachea in order to ventilate the patient, we take that natural ability away from the patient to protect himself from that organisms entering the lung. It's actually like a nice slide for the organisms to go through right into the lung. And that's why a lot of the people that are on ventilators sometimes get ventilator-associated pneumonia. The risk factors, as I just said, bloodstream infections, usually at any catheter site. What is a catheter site for? Remember, patients that are in hospital, they sometimes need an IV line to get some medication. They sometimes have a central venous line for fluids and medication. And they sometimes have an arterial line in order for us to measure the invasive blood pressure. So at all of those sites, organisms can enter the body because the skin has been punctured, and then it can enter into the bloodstream and cause an infection. The patients that's especially at risk is our neonatal patients, especially the ones that is smaller than a gram, okay, at the catheter site. Then also parental nutrition. Sometimes if the parental nutrition is given too long to the patient, it can also cause a bloodstream infection. Okay, we've talked about pneumonia. What is the risk factors here? This happens especially at re-intubation. So if a patient extubates himself, or if he's been extubated thinking that he might not need the ventilator anymore, and the patient crashes and they need to put the ET tube back in, there's always a risk of causing ventilator-associated pneumonia. Patients that's immune compromised, also at risk for ventilator-associated pneumonia. And if the patient maybe had a prior bloodstream infection and gets intubated, he or she is then also at risk for ventilator-associated pneumonia. Urinary tract infections, as I said, bladder catheterization, prior antibiotic therapy, if the patient was on antibiotics before, patients with cerebral palsy is at risk for UTIs, and then just in general, patients with some sort of underlying disease, and then these two risk groups. It's always the smaller ones and the older ones that are at greater risk for infections. Okay, so infection control is important, as I stated, especially if we're looking at epidemiological diseases. The risk factors that increases patients' susceptibility to infection, meaning that if they are immune compromised, we really need to make sure that we do infection control properly, and we have to practice the procedures and treatments that may result, or we should reduce that practices and procedures that might result in infections. So if it's not necessary for a patient to get the IV line, we shouldn't insert one. That's what that actually said. So we should reduce the risk in order to protect those patients. Okay, so there's a lot of different routes of transmission. Okay, we get the direct route of transmission, person-to-person contact, indirect, infection agent deposited onto an object or a surface. So, pen, stethoscope, a cell phone, droplet, so meaning through the air. If somebody sneezes, we've now known with corona, you sneeze into your elbow. Non-contact airborne. Okay, so if the droplet size is less than 5 microns, then especially if there's like a ventilation system, it is important that you understand how the ventilation system works, that the air is not just circulated. So if you are living in a space or working in a space, say for instance in an isolation ward, they wanted to make, in one of the hospitals that are working, they wanted to make an isolation ward within, or a room within the ICU. And it was very easy to do it because, say for instance, the bed is in that corner in the back. We just close off that corner and then we have our isolation room. But when you look at the aircon is connected to this aircon, meaning that the air that is coming out of that area are being circulated and blown into this area, which is not good. So you have to make sure that your system, your ventilation system is separate in the isolation room, otherwise it doesn't help for the isolation. Okay, so vehicle, single contaminated sources. This usually happens at weddings, where people eat the same food, and the food is maybe a little bit off, and then they get like a foodborne outbreak, and then vector-borne, like the malaria, where the insect or the tick actually are the carrier of a specific disease. Okay, so very important, during general care and medical treatment, the hands of the healthcare workers often come into close contact with the patient. Okay? Sometimes, more often than not, you have to touch the patient. And in order to do that, you have to protect yourself and you have to protect the patient. So you have to make sure that your hands are clean before and after you work with the patient. The transmission route by this route is much more common than vector-borne or airborne transmission. Okay? So that's why we are sanitizing our hands, that's why we are washing our hands. So hand washing, very, very important. Okay, so make sure that you wash your hands after touching blood, secretions, excretions, any contaminated items, whether you had gloves on or not. Okay? Wash hands immediately after the gloves are removed and between patient contacts. Use plain soap for routine hand washing and use an antimicrobial agent for specific hand washing. So you will see in the hospitals, they will have these heavy scrubs, these red bottles that you can use where you can wash your hands to ensure that there's no microorganisms on your hands. Okay, so thorough hand washing is so effective that it removes 90% of the transient or superficial flora, including most contaminants. So even if you are in an area where there is no soap, if you just go and wash your hands under water, that physical mechanical movement that you are doing actually assists in helping to get rid of some of the contaminants. That's why you will see in a lot of the countries where Ebola broke out, they had these hand washing stations without any soap or anything like that, in order for people to possibly stop the risk of infection. Sorry, I just want to keep you on the key. Okay, here is the how to wash your hands. Okay, very important. This is where the practical part comes in. I will show you a video now, and next week you will have your first practical test on hand washing, how to put on a mask, how to take off a mask, and how to sanitize your hands. Okay, that's going to be your first practical test in the SimLab. So this is on your notes. You will see on eTutu as well. There is a video link which I will show to you now on how to properly wash your hands. So when we look at it, first you rub your palms together. Okay? Then you rub the back of each hand with the other hand. Okay, so you do this for both hands, not just the one. Then you interlace your fingers and rub them together. Then you bend your fingers and you wash the tips of your fingers. That's number 4. Then you hold your thumb and repeat for both hands. Okay, so you wash your hands, because remember, if you do this, the thumb is not being washed. So that's why you have to wash the thumb separately. And then you make like a little claw and you wash the tips of your fingers again at the palm of your hand. So that is the 6th step in the proper hand washing. Okay, gloves, very important. You get all different types of gloves. The most common type of glove that you will use is disposable gloves that you get. They will be standing around in the hospital. If you're not sure if you should wear a glove, put the glove on. Okay, rather be safe than sorry. So, I don't know if some of you are allergic to latex. Okay, if you are, you do get latex-free gloves and powder-free gloves. So if you are allergic, make sure that the occupational health manager within that hospital knows that. They are responsible to purchase latex-free gloves for you if you are allergic to latex. Okay, so like I said, rather put the gloves on before than after. Mask and eye protection. Okay, face shields. Previously we were not so used to wearing face shields, but specifically in theatre it is important to wear face shields, or if you are scared that some sort of a blood contaminant or secretion might get into your eyes, you get very nice goggles. They're not expensive, that you can buy for yourself. You can use a permanent mark and you can put it on and put it in your scrubs, in your pocket. If you maybe work with a patient that you're scared of that some of this blood or excretions might get into your eyes. And then the face shields, if it is a real serious problem, then you can, so face shields are commonly available nowadays. Gowns, you get different types of gowns. I've ordered just some aprons for us to show, so that I can show you how to put on the aprons. I'll show you how they look now. But for the really serious infections, you can have a proper gown that you can put on. In theatre, the surgeons wear theatre gowns that they put on. And then you get this plastic type of apron that you can use when you're working with a patient, especially if you are touching against the bed. Very important. You will see in some of the infection or higher infection risk, they will have these aprons hanging on the outside the room, and it will be written on it front and back. Now what that means, front is the front to the patient and back is back to you. So when you put it on, don't put the front to your front and the back towards the patient, because that front part is the part that actually touched the patient. So keep the front to the patient and the back to you. Otherwise you're going to contaminate yourself and you're going to take that microorganism on. Patient care equipment. A lot of the items that we use on patients nowadays are disposable, but there is still some reusable stuff. So if you use a reusable, it's important to make sure that it gets cleaned properly after each use. Otherwise, you're going to have a problem. Okay, occupational health and bloodborne pathogens, very important. We in CUT, when you are going into work, we have a what do you call it? We have a specific procedure. If you get a needle stick injury, you call us immediately, one of the lecturers. We will then direct you to either a pharmacy that we are contracted with, where you can then get access to anti-viral drugs, ARVs, antiretroviral drugs. We had in the past that there were some of the some of the students that got needle stick injuries, and the system works well. Don't delay. Please call us as soon as possible, so that we can then set you up with the pharmacy in order to get you that ARVs. Okay? The ARVs sometimes have a little bit of side effects, but it's rather better having those side effects than with the possibility of contracting HIV. Okay. The best thing is not to get a needle stick injury. Now you will see this, you have those sharps bins. Make sure that you always throw away your sharps. When you are working with a doctor, please look at what the doctor is doing. Okay? So sometimes you will have a doctor working on an area, and you will be standing there, and they will take a needle where they've now inserted the IV line or something like that. And this is very wrong from the doctors, but they all do it. And not all of them, but they do it. And then they take that needle and they push it into the mattress to keep it away. They forget about that. Then somebody else comes and they turn the bed or whatever, and that needle sticks. So when you're working with the doctors, make sure that you see what they are doing, where they put their sharps, so that you don't get, if something drops on the floor, see and make sure that it gets picked up. Okay? Then never, never, never re-sleeve a needle. What does that mean? A needle has a little cap that it comes in. So when you take that cap off, now you are ready to give the injection or put something into the IV drip or whatever. So what you do is you take that needle and you throw it immediately into the shaft. A lot of people want to receive it, and then they start talking to each other. And what they do is they have the needle in their hand, of the syringe with the needle in their hands, and they're talking and they receive it, and then it's in your thumb. Okay? If you have to receive it, the way that you do it is you put the cap on a table or a flat surface, and you take your hand with the needle and you receive it like that. And then you can throw it away if you have to. Otherwise, directly put it into the bin. Needle stick injuries happen at the times when you least expect it. So please protect yourselves. Don't be the one that gets stuck with the needle. Okay, so we've talked a lot about how we look at the patient. I'm not going to go through the isolation again and the isolation ward. We talked a lot about that. All the objects that come in contact with patients should be considered as potentially contaminated. Okay, so don't take it that it's clean. If you're not sure, clean it again. Okay, general signs: fever, diarrhea, fatigue, and sometimes muscle aches, very flu-like symptoms. There's a lot of contagious diseases out there, as I've showed you. I'm not going to go through that. And infection diseases are disorders caused by organisms such as bacteria, virus, fungi, or parasites. Many organisms live in and out of our bodies. They are normally harmless or even helpful, but under certain conditions, some organisms might cause a disease. Okay, so now I want to show you that video. Of the hand washing. I just want to make sure that the sound is on at the back. Any questions? Have you looked at the QQ? Can you access it? Because they've informed me and said that the problem has been solved. Do you know if there is still problems?
Sir, was not an hour ago, CPR was still not appearing.
No.
No. CPP can appear all the time, but CPR wasn't appearing.
No.
Yeah.
Because Dr. Gardner told me that they fixed it, but if you say it's not right, I'll ask him again.
I'll clear it now.
Okay.
It's on yet.